Hi, my name is Michelle MacDonald. I'm a registered dietitian nutritionist practicing in Boulder. I provide personalized nutritional counseling for heart health and more. Okay, let's get to the heart of the matter. Today's topic is what is a heart-healthy diet? Very simply, it is a way of eating that protects your blood vessels and your heart and can have a very significant impact. If you're young, a teenager in your 20s or even 30s, a heart-healthy diet may help you avoid heart disease altogether. Heart disease is the #1 cause of death in the United States and worldwide, but it does not have to be part of the natural progression of your life. Some people who maintain low levels of cholesterol throughout their lives demonstrate a near absence of heart disease. That is hopeful. If you have high blood pressure or high cholesterol, it may lower your blood pressure by 10 units or more and lower your cholesterol by 20 to 30% within 2 to 3 months. That is therapeutic. If you are already age 70 to 75 or have already had a heart attack and feel the damage has already been done, a heart-healthy diet may reduce your risk of having another heart attack or of dying from heart disease by 70%. That is remarkable, since our best drugs, the statins, by comparison, reduce this risk by just 30%. So the earlier you start, the better, and it is never too late to start. What exactly is a heart-healthy diet? Come with me while we take a look at a heart-healthy day. Breakfast may be overnight oats made with low-fat or dairy-free milk, nuts, and seeds, a poached egg with veg, and a brown rice cake. Hot oatmeal with fruit, nuts, and seeds, and don't forget the spice. Or herbed egg whites with veggies on whole grain toast. Good choices are whole grains with 3 to 5 grams of fiber per serving, 1 to 2 eggs 2 to 3 times per week cooked with healthy oils like avocado or sunflower oil. Vegetables at breakfast, nuts and seeds in small portions, and fresh fruit instead of fruit juice. A mid-morning snack might be a small handful of unsalted nuts, low-fat Greek yogurt with minimal added sugar, fresh fruit, and a little granola, or a whole grain muffin made with healthy oils like canola oil or olive oil. Notice the heart-healthy fats. More plant-based oils like avocado, canola, olives, sesame, sunflower oil, and others. Less butter and less coconut oil. For lunch, think legumes like black beans, chickpeas, lentils, pinto beans, or split peas. Enjoy hummus or lentil soup or bean tacos instead of deli meats and processed meats. The soluble fiber in legumes is especially good at lowering our cholesterol. One of my favorite simple heart-healthy meals is a white chicken chili made with cannellini beans. It's zesty and flavorful, spiced with coriander, cumin, and ancho chili. Make it fully vegetarian by adding pinto beans instead of chicken and topping with avocado and corn. Onto the dinner menu. It may include chicken, fish, or tofu that is air-fried, baked, grilled, roasted, or stir-fried, with a large side of salad greens or other non-starchy veg, like asparagus, broccoli, Brussels sprouts, green beans, mushrooms, zucchini squash, and others. Tips here are to go lean on protein, enjoy fish and seafood twice a week, and limit red meat to 2 small servings per week or less. Make dessert a small special treat of dark chocolate with dried fruit and nuts or fresh fruit. Enjoying so many colorful, mostly plant-based whole foods will naturally be low in saturated fat and sodium and high in fiber. That is a heart-healthy way of eating. Serious side effects, though, include living many more great years than you ever expected. Ask your doctor if this is right for you. Not surprisingly, I wholeheartedly recommend it. Follow me on Instagram for more heart-healthy tips and recipes. Thank you for listening, and much love from the heart.